Next, we'll move on to pathologic calcification. So, pathologic calcification is nothing but abnormal deposition of calcium in tissue. So, we have two types of pathological calcification, which is dystrophic and metastatic. So, in dystrophic calcification, you remember it is D. So, D for D. So, the tissue deposits of calcium is going to be in dead and degenerating tissues. So, dead and degenerating tissues, you see this calcium deposition. But the calcium levels are going to be normal. Serum calcium levels are going to be normal here. While in metastatic calcification, the deposition of calcium is going to be in normal tissues. So, the tissues are very normal, but here the serum calcium will be elevated. And because of that, there is going to be deposition of calcium. So, let's see about dystrophic calcification. So, dystrophic calcification, as I told, it's going to be seen in dead and degenerating tissue. So, suppose there was a dead parasite or any tuberculous lymph node. So, around the organism, the calcium will be deposited, forming a tombstone for that organism. So, in those things, we can see a dystrophic calcification. Again, in damaged valves like a rheumatic heart disease or any other cause of disease wherein the valves are being damaged. So, around the valves, again, this calcification can be seen. So, when it is going to be calcified, the function of the valve is going to decrease. Then in atheroma, so in atherosclerotic plaques also, you get to see cholesterol-laden macrophages. Along with that, calcium deposits can be seen, and those calcium are examples of dystrophic calcification. Then monkey-bug sclerosis. So, monkey-bug sclerosis is, it has other name also, which is a medial sclerosis. So, the medial calcification will be there in the tunica media of the vessels. So, in elderly age group, especially in women, if you see the vessels will be showing calcification in the tunica media. So, it is a normal change, and that is called as monkey-bug sclerosis, which is an example of dystrophic calcification. Then Samoma bodies. Samoma bodies is an example of dystrophic calcification. And what are Samoma bodies? You see this lamellated accumulation of calcium deposits, right? So, those are called as Samoma bodies. And these are seen in many conditions, many cancers especially. Wherever there is a papillae formation in the cancers. So, just see, if there is a papillae like this, and there is going to be a blood vessel inside the core of it. And I am going to just cut the tip of it. So, there is going to be ischemia at the tip of this papillae. So, when there is an ischemia, this tip of the papillae will undergo necrosis. So, around the necrosis, there is going to be calcium deposition, which is seen in a whorled kind of an arrangement or a laminated pattern. And that is why in any papillary tumors, you tend to see this Samoma bodies. So, what are the examples wherein you see Samoma bodies? All papillary tumors. Examples, papillary carcinoma of the thyroid, and also in serous cystadenocarcinoma of the ovary. So, there again you can see papillae formation. Then somatostatinoma, then again in mesothelioma and meningioma. So, meningioma, even it is one of the classical findings. So, an asbestos or ferruginous body. In pneumoconiosis called as asbestosis, there is going to be deposition of this asbestos fiber in the center, surrounding which there is going to be some other mineral deposition. Most commonly, the minerals will be iron. Okay, so it is also called as a ferruginous body, and it has a classical appearance of a dumbbell. So, dumbbell shaped asbestos body will be present in asbestosis. So, thus and iron plus calcium can be seen in surrounding this asbestos fiber. So, whenever this is present, it is going to be of a dystrophic calcification. So, how do you stain? Use a special, what special stain do you use to identify calcium? We can use alizarin red. So, alizarin red is a special stain for calcium, wherein the calcium will be stained red in color, as the name suggests. And von Cosa stain, here the calcium is going to be stained black. Don't confuse von Cosa stain with Fontana-Mason stain. Fontana-Mason stain will stain melanin black, while von Cosa stain will stain calcium black. The third image is the classical image of a Samoma bodies. Can you appreciate? It is all having this laminated onion skinning kind of a pattern seen in many of the papillary tumors. Next will be metastatic calcification. Metastatic calcification, here the calcium deposition is going to be in normal tissues, but here the calcium levels will be elevated. Serum calcium levels will be elevated. So, what is the most common organ in which the calcium is going to deposit? Most common tissue basically. So, lung alveoli. So, the lung alveoli is the most common tissue in which metastatic calcification takes place. Other than that, we can also see calcium deposition in gastric mucosa, kidney, pulmonary vein and the systemic arteries. So all of these structures are known to secrete some acid, and that is why they are prone for calcium deposition. So the first organelle for calcium deposition will be a mitochondria. So the calcium deposition starts in the mitochondria in any organ except in kidney, wherein it starts depositing at the basement membrane. Okay. The most common cause of this elevated serum calcium will be hyperparathyroidism. Okay, hyperparathyroidism, and this hyperparathyroidism can be a result of parathyroid adenoma or hyperplasia, but more of a parathyroid adenoma. So all of these can be asked as MCQs. Most common cause of elevated serum calcium is hyperparathyroidism caused due to parathyroid adenoma more than a hyperplasia. So let's see examples of metastatic calcification. So whenever there is an increased secretion of parathormone, it can lead to hyperparathyroidism. So in some tumors, there is going to be a paraneoplastic syndrome wherein parathormone related protein or PTH-RP, which is secreted ectopically by the tumors. So those can result in hypercalcemia, especially breast cancer and lung cancer. So breast cancer is the most common cancer in which hypercalcemia is seen. Then whenever there is a bone resorption, so bone is composed of minerals like calcium. So whenever bone is resorbed either by a primary disease of the bone like an osteolytic lesion, Paget's disease of the bone, or there is some tumor which is infiltrating the bone like a leukemia, lymphoma, or some metastatic tumors also. So here again this bone is going to be resorbed, and that will result in elevated serum calcium levels. Then some vitamin D related disorders like sarcoidosis. In the sarcoidosis, there is going to be vitamin D producing granulomas. So remember, in sarcoid, the granulomas produce vitamin D, and that can result in hypercalcemia. Then in renal failure, secondary hyperparathyroidism, there is going to be phosphate retention that will result in the secondary hyperparathyroidism. So this image was also asked once. So this is an example. This is actually a tetracycline labeling, double labeling index. It is used to detect the bone mineralization. So two lines are there. So based on that, they'll detect the bone mineralization by labeling a tetracycline. Okay.